Good evening. Welcome back to Let's Talk About Mental Health. I'm Nels Kloster. I'm an addiction psychiatrist and I work in Southern Vermont.
And I'm Robert Stack. I'm a licensed alcohol and drug counselor. Good evening.
And just to remind you for sending in questions to us, we have a Facebook site at facebook.com/letstalkvt. And our email address is questions@letstalkvt.com.
Okay. Got a couple of email questions.
Right, and some cards came in as well.
I managed to print them out, which was a technological leap, if you will. But anyway, so I'm going to read the question. This is, I just have to say, this is really good. This is what I was hoping for, is that we would get questions, we would get dialogue from the community, and you know, I'm really pleased that this is working out so far.
Yeah, and of course, email has the sort of return address on it, so we're not going to mention who sent these.
No.
We'll keep these confidential.
No. And but I want to thank the person who sent them in. Yeah. So question, I myself have a history of depression and anxiety, yet I don't see these problems are caused by my genetics, but rather my upbringing and environment. I have tried some medications and they don't seem to really help that much. A healthy lifestyle seems to work best for me to keep the symptoms under control. But sometimes it feels like I am doing too much work just to keep from slipping into depression. And this is the question part. My worry is that medication will help, but won't solve the underlying psychological problem. If I take medication, I might feel better, but I won't be motivated to understand the depth of my predicament. The suffering, parentheses, symptoms, end of parentheses, give me a reason to keep digging deeper and trying to figure out what is going on internally. Do you think this is healthy? I function pretty well and have good relationships with people, but it takes up a lot of my time and I don't have as much energy to devote to a career or having a family. When should a person stop trying to solve their problems internally and just take medication to help them? Okay.
Well, I hope we're gonna be able to remember all the points and address those, but there's a lot of important questions in there. I'm hearing about what's the role of therapy versus the role of medications. What is one's own responsibility, which might sort of self-efficacy or the power to improve your situation or make changes, as well as, I don't know, almost like a spiritual quest here, sort of like on a path towards you know, self-awareness or enlightenment even.
Right, yeah, I mean, well, one of the things that sort of strikes me, and you know, we had a chance to look at the questions before the show, and it is a, I mean, I think it's a legitimate question on one hand, and you know, I tend to be in favor of talk therapy. I like cognitive behavioral therapy, and yet, you know, spending most of my years of working as a counselor was in a psychiatric hospital, and we used a lot of medication. And a lot of people, by the time they showed up in the hospital, medication seemed to be the right intervention at that time. You know, I appreciate the question, because what I ended up doing in some cases was, you know, I would work with people with dual disorders, and I would recommend they go to AA. I mean, you know, I would recommend that they do cognitive behavioral therapy with therapists, and at the same time, I would often recommend that they take their medication. Right. So,
a part of this, you know, what we've there's almost like I almost just to call it a fad, but you know, social attitudes really have had important interplay with psychiatry over centuries, and there is this sort of prevailing idea that none of us should have to suffer, that we should be allowed to be happy all the time. And let's face it, that is not a realistic situation whatsoever. You know, life is not a bowl of cherries, as they say, and there are going to be difficult times. And what we've seen is that, you know, we've talked about this before, about the role of pharmaceuticals and medications. What's happened is, by the companies being able to market to us as individuals, that people are in the impression, well, you know, I don't have to do all this work of being well, I don't have to make all these sorts of changes. I should just be able to take a pill and feel better. But that's also based on the pharmaceutical companies having hidden from us a lot of the studies they did that showed that the medications didn't work any better than sugar pills or placebos. So it's really a disservice, because what we're learning now is that medications do not work for lower levels of depression. You know, back decades ago, antidepressants were only used for people who are severely depressed, most to the point of hospitalization or not functioning. They weren't able to go to work, they weren't able to interact with their families, maybe staying in bed all the time. And then so serious medications with more side effects for a much more serious spectrum of the illness. When you're talking about sort of mild and maybe up to moderate levels of depression, you're talking about you're still going to work, you're still sort of maintaining some relationships, you're not really going to benefit quite so much from medication.
Right.
So,
and partly the other thing that struck me was, on one hand, he talked about the depth of his problem, and then in the next sentence he says, you know, I have good relationships, I function fairly well. You know, should I keep digging? And you know, and normally I guess, I don't know if I'm being a smart aleck about it, but normally I would sort of suggest leave it alone. Like, yes, stop digging. Except he said he was suffering.
Yeah.
And so, I mean, you know, it's one hand to tell somebody, you know, stop looking for trouble. You know what I mean? Right. You're functioning, you're doing well, you have good relationships. You know, the past is past, but if somebody's suffering, then obviously, you know, you want to understand that. But
this strikes me as someone who is probably rather introspective, and looking for insights into themselves, how they come to be the way that they are. And maybe even sort of using suffering in that sense that Buddhism implies, where we're always suffering. We're sort of dying slowly, we're suffering. Meaning we have struggles, meaning that we're not going to be happy all the time. And I'm thinking, as you're saying that, and again, I'll be very sort of simplistic about it, but sort of like a conflict between psychoanalysis, which if you think about sort of the laying on the couch, and Freud is what that's associated with. And then you look at more currently, you know, cognitive behavioral therapy, which we've often talked about, where you examine your thought patterns, your ways of thinking, and understanding that they are maybe negative, leading to anxiety and depression because they're based on some core beliefs that you're not good enough. And you know, cognitive behavioral therapy, or CBT, was actually developed by, more prominently by Dr. Aaron Beck, who was a PhD. And he was a psychoanalyst. So he sort of, you know, doing that work, came around to developing CBT. And if you're going to get into sort of like a debate about it, the psychoanalysts will say about the folks doing CBT, that's cookbook, that's simplistic, that's just absolutely not what psychiatry or, you know, mental health is about. And then the folks at the CBT will say, you know what, you're lying on the couch for an hour a day, 3 days a week for 10 years, and you're not getting any better. What a complete waste of time. There's no evidence to support that. And they will take the stance that we don't care about why you became the way you are. You're in a situation currently, and using this method, you can start to feel better and think more accurately or more positively.
And you know, I love to read old history books, like textbooks, like they were written in the 1920s, 30s, 1880s. If I can find one, I read it. And one of the things that you learn about history, about writing history, is that as they write about the past, it's very reflective of what's going on in their present.
Right.
In other words, their perspective on the past is sort of dictated by where they are.
Right. We always have some kind of a bias or a point of view.
That's exactly right. And I also, and so I think sometimes when you keep looking at your past, you interpret it based on what's going on with you in the present, or where you're standing. In other words, where you're standing changes your view of what you see when you look backwards. And the other thing that I said this once, and a friend of mine laughed at it, but it was like, we sort of know now that eyewitness accounts you can't trust them. And I think that's especially true when you're the eyewitness to your own life.
Experience, yeah.
Now that sounds counterintuitive, because no, I know I was there. Yeah, but still, I don't know if the way I remember things or see things, I'm not so sure that's how they are. Yeah. I'm not so sure. And to spend a lot of time going over it, hashing over it, like nowadays, I'm pretty introspective, but I put a stop to it by just admitting that I'm flawed.
Right.
I've
heard you say this. Yeah.
No, I mean, because then I don't have to get into this whole like, oh, well, how did I end up being flawed? I am. This is, Yeah. So, and I think on some level, I don't know this person, and I don't mean to take lightly, but I wouldn't spend too much time. And if you're suffering in the present, I would look more in the present. I would see, what's troubling you now. Is it your, like you were saying, your belief system? Your what they call automatic thoughts, underneath the automatic thought is your core beliefs. Are you violating some core belief or something? You know what I mean? Like that's all I can imagine. Right?
So in some ways, maybe the advice might be, get over it, get on with it. And again, maybe another is this approach working for you? And maybe there is no answer there. And maybe all this time spent is not going to be fruitful. And maybe try a change in direction to be more sort of present oriented.
Right. Well, I don't know if we helped that or but
and this thing, and talking about the relationships with people too. I mean, too much introspection, too much isolation. Of course, it's not good for us. We're social animals. We're pack animals. We're meant to be with other people. And whenever we go against our sort of genetics or evolution, we're going to find ourselves unhappy. And there's some theories that depression is a result of spending too much of our resources on something that is not going to happen or that we're not going to be able to pull off. And maybe that's the example here, is too much time spent on this introspection, maybe more time spent reaching out with other people, being sociable, and spending energy strictly on these pursuits of career and relationships.
That's great. Now, I'd like to put out an appeal for any of our people who are watching this show. If they have any comments about this question in their own life, if they've had this experience of making a choice between staying on meds, going into more talk therapy, or digging deeper into issues. So if anybody out there has a personal experience with this question, I know many people do. I mean, when do you stop taking your antidepressants? What will happen? So if anybody has any comments or suggestions, or even more further information, feel free to send us some information on email. letstalkvermont.com. Questions at letstalkvermont.com. So please, if you have any comments.
And absolutely, medications by themselves are never the answer. It will still require work. So if medications are important to sort of get to that point of being able to continue to do the work, then please don't be ashamed or embarrassed about taking medications. It might be the thing that allows you to pursue the course you want to pursue.
Now you realize there's probably people out there on benzodiazepines for 10 years tell you, oh no, my Klonopin, my Xanax,
I'm not saying
it's the answer.
I'm not saying they're not effective. I'm saying they for good health. Right?
But I used to get clients like that would come in, and like when the doctor would say, we're going to take you off the. Oh no, I've been on that for years, and I can't live without it. They don't see benzos as being addictive. Like you could have a coke addict and they would honestly say, I'm addicted to it or whatever, heroin. But whenever I worked with somebody who was overly dependent on benzodiazepines, they were very defensive about it. I mean,
well, maybe
much worse than anybody else.
I wasn't suggesting benzodiazepines for anybody, particularly not someone with doing as well as
that's right,
as healthy as this person seems to be.
If you're healthy enough to send in questions, maybe that could be it.
That'll be a thing. So then, one of the cards. So this writer, I started seeing a new therapist who was highly recommended, but I don't like her. What should I do? Yeah, that's a good question. So I would be curious about why this person didn't like the therapist. I think that's a very important question, and we can think of a lot of reasons why that might be, right?
Yeah. I used to recommend to people not to. Sometimes I did a class and I would talk to folks about it, and I would recommend not that they not worry about whether or not they like their therapist. I said, if you, I can remember I went into therapy for a while, and I remember they were very painful, and they were very difficult. And I said, if you're having a good time, I used to, I mean, if I had a therapy appointment on Wednesday, I'd be thinking about it on Sunday, Monday, you know, and I would. I mean, oh my God, you know, and you know, what are we going to bring up? What are we going to talk about? Where we're going to go and all that stuff. It was very stressful. And so I just wonder about that. I understand the business, and I understand, like, you want people to, you know, have a good relationship with your doctor and all that stuff, you know. But to me, I think good therapy should be uncomfortable. I think good therapy should be a little bit anxiety producing. And I wouldn't worry too much about whether or not you like them.
Right, because this is a different kind of relationship than we're used to. Especially if you're coming to therapy for the first time, all of your relationships have been with people that you like. They're friends, they're family members, they're lovers, for example. And each of those has a different level of intimacy, different sorts of things that are talked about. And your relationship with your therapist is going to be intimate in a different sort of way, where you would be able to talk about topics that you would not bring up with family, friends, and lovers, and actually scare them away. That is safe material for your therapist. So they're not your friend. If your therapist is taking out for coffee, I definitely go find another therapist. If they're making you uncomfortable, and it's because they're making you work and explore things that you don't want to explore, that's probably someone that's very, very competent, and that's going to be important work, and not to be so concerned about not liking them in that regard because you hate what they make you think about and do.
I took a graduate course in Carl Rogers at UMass, and it was probably in over my head, but I enjoyed it. But at one point they showed a film, and they had these 3 different doctors working with this client. And Carl Rogers was very warm and genuine, and, you know, I like to think of myself that, you know,
positive regard.
Yeah, it really matches my style. But there was another one who was very abrupt. He was very sort of like, you know, go do this, go do that, you know. And afterward they did a follow-up, and I don't know if this is true or not, you know, I don't trust research, but they said he was more successful and his clients getting better. One. That's right.
Wow.
And he was almost to a point of like being, you know, I'll just tell you, So I've mentioned this before the show, that there was a medical doctor here in town that, you know, was a great diagnostician. Did I say that right? But not the bedside manner.
Right.
And you know, it was fine, and I worked with him at one point at the hospital. But people would sort of be upset with him, but they had just gotten the best information they could get. You know what I mean? So you want to be careful about that. You know, I mean, what do you want? You want somebody that smiles and you like, or maybe you want somebody who is pretty good and just tells you what he thinks, and, you know, I mean, I don't know if that's fair. Or not.
That being said, too, there's something called therapeutic alliance, which means to do what, you know, a positive or a negative bond or that you feel with the therapist. And, you know, away from the sort of classic, just sort of, do I like you sort of a thing, you have to feel that sort of respect or comfort that this is a person that you trust, that you feel some sort of connection with. And some, you know, interesting studies that really support the idea this feeling has to be there, that if you had this sort of feeling about a newbie out of therapy school, and you did not have that about sort of the, you know, the most expert and renowned therapist, you'd be better off with that novice than you would be with that experienced therapist, because that lack of a connection there would interfere with the therapy, and it just wouldn't develop for you.
Yeah, when I was a young counselor, you'll have to forgive me for telling you this again, but this Don Annis, who was a psychologist at the hospital, he said to me, he said, "Robert, your enthusiasm when you begin will make up for your lack of technique. And as the years go by, your technique will make up for your lack of enthusiasm." And there's some truth to that. I will say this, working with addicts and alcoholics, and I don't know if this person is, but occasionally, and I don't know how to, one way to, I can't verify this, but some of them would say that they were treated less by, because they were alcoholics or addicts, and that they weren't, they felt like the therapist thought less of them, you know, made judgments of them, and did not really like, didn't necessarily like them as clients, I guess. And I guess I would be careful about that. If the person felt like, I don't think he's looking at me as a person, as he's looking at me as an addict, as someone, you know. You know, I think maybe if you picked up on that, I guess that would be a legitimate cause to step away. And you know, I mean, the first answer I think we should say to this is to talk about it with the therapist. The next time you go in, don't walk away from therapy. Go back in, talk to the therapist, tell them your experience and your feelings, and you know, maybe it's transference, whatever it might be. You might learn from it. But if you truly feel like this person doesn't like who I am, they're treating me in a way that I don't think is respectful, then I think maybe it is time to move on.
Oh, absolutely. And we've had some colleagues who are, you know, wonderfully empathetic, and even if they had to deliver, say bad news, or no, I'm not going to do this thing you want to, they did it in such a way that people knew that they were cared for, and they could handle that sort of you know, negative you know, result there. And then too, you know, again, you talk to the therapist about this. If they're too thin-skinned to be able to handle this kind of conversation, then they shouldn't be in the business. And I mean, personally, I've a number of times in a way had to ask for, say, a do-over. You know, we didn't get off to a good start. I acknowledge my piece in that. And if we could, let me start over again. And see how that works. So don't give up, but definitely don't hide behind it. Don't just stop showing up. This could be quite a growth experience to address it head on.
Right, and again, there's something to be said for the first couple sessions with a client of setting the ground rules, and being as clear and as frank and as open as you can, without offending. I think there's something. I mean, I think that's a good thing. And then, you know, if the worst thing that I saw was patients would stop going to the therapist. They just would drop out of therapy. You know what I mean? They would just not follow up on therapy. And that, I think that, you know, that didn't help them at all. Now, granted, most of the folks that I saw in the hospital had relapsed and were in trouble psychologically, whatever, addictive. And so, you know, when they told me they quit going to therapy, I'd be like, well, maybe you need to rethink that, you know. They say, well, therapy didn't work, and you know, so I stopped after 2 sessions. And I'd be like, well, you might want to give it another chance.
You really don't know, because the first session is just going to be, tell me about your life, and the second session is where the first one you maybe start to do some of the real work. Right.
And you never know. I mean, it could have been this person also, and this is one of the things that you have to be careful with addicts, is they sometimes will go in and say, and alcoholics, this is what I want. And if you've ever been with them, you would say, well, I can't give you that, but why don't we talk about something else? No, I don't want to talk about that. Well, I want what I want. And, you know, can you help me with this? And it's like, well, not now. So, you know, sometimes you have to wonder how much of this baggage is...
maybe what she wants is not on the menu.
It's not on the menu, that's right. And she thinks this guy doesn't like me, and that's why I'm not getting what I want. Boy, we had a lot of fun with that. That's probably
that
not
was
fair
for a
that
short
person.
question. Well, we did, you know, one of the unfortunate things, and by all means respond if we're wrong, is we have to make some assumptions.
That's right.
We'll read something between the lines.
Right. And I hope it's helpful. I mean, again, you know, if any comments that people want to make, or if the individual wants to follow up with this and make another comment, I'd love to hear from them.
So we might take it in the right direction.
That's right. That's right.
Okay. And another email, right?
All right. So I get the emails, you get the cards. Is
good.
that it? All right.
Sounds good.
All right. Let's see. I'm not sure about this. Okay. I have spent a lot of time living in alternative communities that attract people who experience life in very unusual ways. They have what I think are called schizoaffective personalities or tendencies toward abstract thinking and mystical visions. Some of these people describe experiences that seem to border on psychosis or some other form of mental illness, yet they interpret them in a spiritual way and sometimes are able to incorporate them into their lives in a productive way. Other times the experiences are too much and seem to intrude into their lives and cause chaos and confusion. When do you think a person should seek medical help when having these types of experiences. If a person considers these experiences to be authentic, should they turn to spiritual guidance and the doctrines of the world's religious traditions, or consult a psychiatrist?
Okay. Boy,
Yeah.
let's hope we can start to do justice to this one. You know, one thing I'm struck by is there's the idea of sort of what are mainstream ideas. And these can, of course, be different across cultures. So some things, for example, like talking to the dead, for example, ancestors, might be considered crazy in some places, but in other places considered perfectly normal. So there are sort of, you know, cultural norms around a lot of things. And then the question of when does a set of beliefs become abnormal? You know, one of the things we talk about with delusions, which are, you know, the most common one being sort of paranoid delusions. Those could be, you know, religious delusions or grandiose delusions. The idea is that the idea is fixed, it's firm, and there's no dissuading people from this. This is what they actually believe. And some people can have these sorts of sort of odd personality types without necessarily being considered as schizophrenia, but maybe it was sort of a schizotypal personality, which is very much like that, but they function very well in other areas. They don't hear voices or see things that aren't there. And thinking back to medical school, when we were sitting in the classroom and we had one of our first lectures on psychiatric issues, and they brought up the idea of delusions being these sort of fixed and permanent fixed and false ideas. And if you really wanted to sort of play with that or dig down, one of the questions that came up quite often out of the class was, well, what point, for example, when you look at established religions, or you look at maybe newer religions, or you look at, say, cults, there's sort of a spectrum there. And at what point do you say that is a acceptable or reasonable belief? And at what point do you say it's not an acceptable belief? In a way, I think somebody put it sort of, trying to be humorous, how many people have to believe what I believe before it becomes considered a religion instead of a delusion?
Yep.
So I'm wondering if this sort of alternative communities is fitting somewhere in that spectrum of there's enough people that believe that and feel comfortable together practicing that it's okay as long as they're functioning well, they're not harming anybody else.
You know, we're going to run out of time. We only got a few minutes, and one of the things that's so interesting, and I know our producer, one of them, was very interested in using LSD for a certain medicine, using some different types of medicine for different things.
For spiritual
and I know
experience,
people who have said that they experience a spiritual experience under the influence of drugs, and it really changed their life. I think we need to talk about this again, because this came up under, as you know, I used to recommend people go to AA, and the founder of AA, Bill Wilson, was in the detox, and he said he had this spiritual awakening experience in the hospital room. And a lot of wise guys, people made fun of that and said, oh, it was his detox meds. They used belladonna and blah, blah.
So he hallucinated on medication.
But somebody investigated the dosage. It's not that hard. There's medical records. They went back, they looked, they said, no, it's highly unlikely that it was induced by their medication. And it's probably not with anything. But he was a seeker. He was a spiritual seeker. He had been looking for this solution. He'd been going out to the Oxford group and stuff. So I just want to say that, you know, he wrote and said, if you're lucky in your life, you can have sometimes these visions, these things that change. You see things differently.
This sudden thunderclap where all of a sudden I'm enlightened or something like that.
But for most of us, it's a gradual process. Most of us, it occurs over time that we develop some spiritual way of seeing the world. There's rituals and customs. So I'd like to go back to this and talk about this some more. We also have another card, so that's for another week. I want to thank you. I hope this was helpful. Keep those letters and cards coming in. Send us an email. Thank you very much.
Yeah. Good night.